What's up, Doc? My name is Carter LaFontaine, and I'm a project coordinator with the Fraser Northwest Division of Family Practice. My organization is proud to host this new community education series with the assistance of some fantastic physicians whose knowledge and expertise are the driving factor behind making these sessions possible, as well as community partner organizations who endorse our various topics, presentations, and provide support where they can. Before we begin today's session, I'd like to give gratitude, recognize the traditional lands of Coquitlam, Coast Salish, Kikite, Musqueam, and Tsleil-Waututh peoples, where we have the opportunity to work, live, and play on. This land acknowledgement would not stand appropriate without bringing to the attention the recent tragedies that have been uncovered at residential school sites in Kamloops and other locations across Canada. As parents, or soon-to-be parents, recognizing that the youngest child was identified as under 3 years old, and this is just quite horrific. I can't imagine just how hard it must have been for Indigenous parents and children during this time. It's unimaginable. So basically, the healthcare field is being called upon to address the healing process of this tragedy through education, respectful practice, and working with the courage to stand up for what is right in this fight against systemic racism. That said, I'd like to now take 21.5 seconds of silence for those victims that we've learned about at these residential school sites. What I'm going to do is I'm going to turn off my camera now, and I invite those of you with your cameras on to do the same. And I'll return when the 21.5 seconds is up. Okay, thanks everyone. Really appreciate that you took the time to do this today. That moment of silence was definitely special. Next, a little bit of housekeeping. You will notice that there's a link to Slido and the code to the session in the chat box below to the right of your screen. For tonight, the chat will be disabled on Zoom, so any audience questions, answers, or comments can be sent via Slido. So you can feel free to use your phone, computer, or tablet to interact with Slido while the presentation occurs. We'll be keeping up with all the questions that you may have. And if you have any technical issues with Slido at all, please type a message into the Zoom chat where myself or a fellow team member will do their best to help you navigate through this. With that said, I'm excited to hand things over to tonight's speaker, Dr. Christine Sorial. Thank you.
All right. Hi, everyone. Good evening. Thank you so much for joining us on the first day of summer. I think officially it's today. This is our very first What's Up Doc event. And so we're really excited to have you all here tonight with us. Today, we're going to be talking about baby's first year. So that's going to be the focus of tonight's presentation. We're going to be talking about a few different milestones, different stages. I'll be sure to share some tips, and then we'll talk about a few other topics throughout the presentation. Ideally, we're trying to create a very interactive session tonight. We're limited, of course, by Zoom and by COVID and all of these things. I do really encourage you to ask your questions on the Slido. So if you do have any questions, please don't hesitate. Ask, and we will try to get through all of your questions during our Q&A at the end. Trevor, can we progress to the next slide? So I'm Dr. Christine Sorial. I'm a local family physician here in Coquitlam. So I've been in practice for a few years now. I work in a variety of other capacities in our community, and I'm really happy to talk to you guys today about this topic. Next slide, please. So just a brief overview of what we'll be talking about. We're going to start with a discussion on baby milestones. We're going to talk a little bit about the newborn stage. 2 months, 6 months, and 12 months. We'll talk about growth and nutrition within each of those ages and stages. We'll talk a little bit about safety, and then I'll share some tips with you as well. And then we'll finish off with just reviewing and sharing some local resources in our wonderful community. And then finally the Q&A through Slido that I'll be answering live. Okay, next slide, please. All right, so here we are in the newborn stage. I do have a quick question for you guys. So poll is going to come up in a moment. We're going to do a bit of a quiz here before we get started, just to test your knowledge, just to make it a little bit more fun. So go ahead and ask the first question. You'll see it here. And if you're able to choose and select your answer, that would be great. Just give us a moment. Are we able to put up that question? If not, it's okay, we can move along.
Is it not showing?
I don't see it unless it's showing to everybody else.
Okay.
You know what? No worries. Okay, well, let's go on to the next point there, the mom check-in, Carter. Okay, so I know we're talking about baby health today, but I just wanted to take a moment just to acknowledge that maternal health is also a really important topic, and we're not going to be discussing this in detail, but I do want to acknowledge that during pregnancy, there's such a huge focus on, of course, prenatal care, mom's health, and of course, fetal health. But then as soon as babies are born, that shift goes entirely to the baby. And sometimes even in healthcare, we neglect maternal health. And so I do want to acknowledge that there are so many changes that happen in the postpartum period, both physical changes and emotional changes. And I really encourage you to reach out to your provider and to ask for support and to get your needs met, whether it's about, pelvic floor, perineal care, or C-section scar, or even if it's about emotional support around the new family dynamic, or mood changes like postpartum blues, or even postpartum depression or anxiety. So it's really important that you reach out when you can. Next slide, please, Carter. So let's delve right into talking about infant nutrition. So, of course, the first few weeks of life are all about babies gaining weight and feeding. And so feeding happens either through breastfeeding or express breast milk, or from formula. It could also be, of course, a combination of any of those three altogether. We did have a question about the type of formula that's recommended. Standard recommendation from the Canadian Pediatric Society within Canada is a cow's milk-based formula. Some babies do require alternative formulas, for example, a soy-based formula, or ones that are hydrolyzed, which means that the protein content is broken down within that formula. But most babies require just a standard cow's milk-based formula. Now, there used to be a really big public health campaign, of course, and I'm sure you're all very familiar with it, but about breast being the best. Of course, breast milk is amazing, but there's definitely been a bit more of a shift in the recent past where what we want to ensure is that your baby is growing and thriving and gaining weight. And if that comes from formula or express breast milk or donor breast milk or breastfeeding, no matter what, the priority is that baby is thriving and gaining weight. And so how much and how often? A really simple rule of thumb that I find is really easy to remember is the rule of threes. So about 3 ounces of milk every 3 or so hours. And that's a little bit, of course, easier to gauge in babies who are drinking milk from a bottle. So for those who are breastfed, we use slightly different signs to ensure that baby is getting the right amount. And of course, we make sure that baby is nice and full and satiated after meals. And the best way to determine if baby's getting exactly what they need is by monitoring their weight and their growth. So babies are generally born at a certain weight. Oftentimes they will lose some weight around the time of discharge. Generally speaking, we allow about 10% or so of weight loss of their total body weight. And we hope and we monitor babies in order for them to regain and reach their birth weight again between 10 and 14 days of life. Usually babies are gaining about a half a pound every 9 to 10 days in the first few weeks of life. In the office, when you see your provider, we will of course weigh the baby, and we also look at how much baby is growing on average on a day-to-day basis. On a day-to-day basis, we like to see about 25 to 35 grams of weight gain every day. And like I said, birth weight should be reached again between 10 to 14 days after a baby is born. Of course, we also recommend vitamin D. So vitamin D is in almost all formula. So if your baby is getting their milk from formula, you don't need to supplement with vitamin D. But for breastfed babies, it is recommended that you give your baby about 400 international units of vitamin D every single day. Next slide, Curtis. All right, so we'll just transition into talking a little bit about sleep. So newborns seem to sleep all day and often will be awake all night. So that's normal and that's healthy. As your baby gets older, awake times will become a little bit longer during the day and sleep times will stretch at night. And that's as they establish their circadian rhythm. So safe sleep is so important. Probably sound like a broken record. I'm sure you've all heard it before, but babies need to sleep on their backs. Babies should be sleeping in a crib or a cot that has nothing else in it except for a fitted crib sheet and your baby. So that means no pillows, no toys, no bumper pads, nothing else in that crib. And that's to minimize the risk of SIDS or sudden infant death syndrome. Now, some babies need to be swaddled, and we get a lot of questions about swaddling. Is swaddling safe? Is it okay? Is it recommended? Swaddling is okay. Again, some babies need it in order to sleep. So just a few points here is that if your baby is swaddled, and if your baby is not swaddled, always keep them on their backs. You can swaddle with a light blanket to avoid overheating, so just a cotton blanket. And then wrap the baby from the shoulder down. The swaddle should not be too tight. So there have been some studies that have shown that swaddling too tight can actually lead to hip dysplasia, which is unstable or loose hips. And that's if parents are swaddling their babies tight around the hips and tight around the legs. So make sure that your baby's legs are staying slightly bent and spread apart when you swaddle them. Now, as soon as baby starts to roll, it's important that you stop swaddling. And that's because babies who are swaddled and roll from their backs to their stomachs may not be able to roll back. And so generally we recommend that you stop swaddling between 2 or 3 months of age, or as soon as baby starts to roll, whichever one comes sooner. And then you can transition to a sleep sack after that as needed. Okay, next slide, please. All right, so we'll move on to the 2-month period here. So we'll start with talking a little bit about growth. So of course, at 2 months, nothing really changes from a nutritional standpoint. Babies are still either exclusively breastfeeding, or they're formula fed, or it's a combination. We do like to, of course, track babies' growth on growth charts. So I'm just going to show you a couple of examples of growth charts, which you may have seen before. So we use the WHO, or the World Health Organization, growth charts, because this is what's based on children. This is based on children raised according to Canadian Health and Nutrition recommendations. The WHO growth charts, they are based on breastfed babies. So that's an important thing to keep in mind. And they're also for babies who are born at term. So those who are born at 37 weeks or later. Babies who are born premature need to have their growth calculated just a little bit differently. Generally speaking, breastfed babies grow a little bit faster in the first 6 months of life in comparison to non-breastfed babies. And then after this, breastfed babies grow a little bit more slowly compared to non-breastfed babies. So you can see here on either the boys or the girls chart that you have the length at the top, the weight at the bottom, and then you have the curves. The curves are curves. They're not straight lines. They're not exponential growth curves. They are a nice steady curve, and that's how babies gain weight. And that's how we track babies' weight and growth. So if we zoom in a little bit, you'll see that there are various percentiles. Percentiles are used to see a child's growth relative to other children of the same sex and age. So for example, if your baby is on the 85th percentile, that means that 85% of children weigh less than your baby, and 15% of children weigh more. So that's important to keep in mind. Normal is not the 50th percentile. Normal is anywhere from the 3rd all the way to the 97th percentile, so long as your baby is maintaining a consistent growth curve. And that's also why one-time measurements are not entirely helpful. So we always encourage you to come in at various time periods so that we can track your baby's growth and make sure that they are being consistent. We're plotting them over time. And remember, the goal is not to be at the 50th percentile. Just like adults, children have different genetic potentials. So some have the genetic potential to be shorter or taller or heavier or lighter than average. And so what's important is that they're maintaining their own curve. Most babies will maintain their growth consistently along 1 percentile, but it can be normal for babies to change 1 to 2 percentile for either weight or height in the first couple of years of life. A sharp incline or a sharp decline or a flat line needs to be checked, of course, by your doctor. And then generally speaking, a rule of thumb is crossing 2 or more percentiles really needs to be looked at very closely by your doctor as well. Let's go to the next slide. And if you have any questions just about the growth charts, of course, just let me know. All right, so we'll talk a little bit about development here. So in social and emotional development, let's head there. What we like to see is some beginnings of your baby's personality shining through. So babies at 2 months are able to coo, they're smiling, smiling responsively as well. They enjoy visual stimulation, which is why it's so important to play with them and to interact with them. That's how they learn. And of course, they're comforted by touching or rocking. Okay, next slide, please. All right, and then moving on to gross motor skills. We do like to see babies at around 2 months to be able to lift their head during tummy time. Tummy time is so important, and it can be started from the newborn period, actually. It helps to encourage babies to develop their head and neck control. It helps to develop their trunk strength. And it also helps to prevent flat spots on the back of baby's head. So remember, we talked about babies only sleeping on their backs. And of course, with babies sleeping on their backs, we're seeing a lot more flat heads. And so doing a lot of tummy time can help prevent a flat head. We generally recommend between 10 and 15 minutes, at least 3 times a day. Around 2 months of age as well, we do want to make sure that your baby is following movements with their eyes, so they're tracking objects as they go along their vision. And if you feel like your baby is not meeting some of these milestones, again, it's important to check in with your doctor. Okay, next slide. Okay, so just a few little tips here. One thing that I usually recommend is obtaining an ear thermometer or a tympanic thermometer. I actually recommend it from the newborn stage. It is important to have a reliable way of checking baby's temperature in case there is a chance for a fever, which is a temperature greater than 38 degrees. The ones that go in the armpit, or the new ones that are non-touch, that just check the temperature from the forehead, are not reliable in babies. So it's important that you have a tympanic thermometer. The next point that I just wanted to chat about is about sun protection. So of course, now we're seeing beautiful sunshine finally, and we're heading into the summer months. So it is important that we keep that in mind for our babies. The Canadian Pediatric Society does not recommend sunscreen for babies who are less than 6 months of age. So older children over 6 months can wear a sunscreen that contains an SPF of 30. And so for younger babies, the most important step is to really reduce exposure. So try to cover your baby in lightweight or loose or cotton clothing, a wide brimmed hat in order to keep the sun out of the baby's face. And of course, even just keeping baby out of direct sunlight is really important. And that's because baby's skin is very thin and very susceptible to burns. So for children who are over 6 months of age, you can use a sunscreen that is SPF 30. So make sure that you choose one that covers both UVA and UVB rays. There are 2 main types. There's a chemical sunscreen and a physical sunscreen. So a chemical sunscreen, as the name implies, contains chemical products that are absorbed into your baby's skin. And that's what helps to block UVA and UVB rays. And then there are a physical barrier sunscreens. And so these actually sit on the surface of the skin and they act as an actual barrier. They're not absorbed in the skin. They do contain titanium dioxide for the most part, or zinc oxide for the most part. So similar to what you would use like a diaper cream, it's a similar product to what's in a diaper cream. So again, they're not absorbed, they sit right on the top surface of the skin. So the key is really thorough application with these ones, because anywhere that sunscreen is not, you will not get the coverage. And then I just want to shift and talk a little bit about teething. So this is the stage where some babies can start to exhibit signs of teething. Typically, it starts around the 2 to 3 month mark. Most babies won't get their first teeth until about 5 to 6 months of age. And so just a couple of points that I wanted to discuss, and it's just about numbing gels and amber necklaces. So are numbing gels safe? The answer is no. Numbing gels are not safe. We do not recommend them, and that's because they're not regulated. They actually have some rare side effects. They also contain topical anesthetics like lidocaine or benzocaine, and they can actually be harmful if swallowed. So we don't recommend numbing gels. Remember that teething cannot cause a fever. So some people do think that, and it's a common misconception. So teething can increase baby's body temperature slightly, but not enough to cause a fever of 38 degrees. And then as far as amber necklaces go, they were definitely a huge craze, and maybe still are a little bit, but really very hugely popular in the last few years. Again, they are not recommended. So the Canadian Pediatric Society does not recommend them, and that's because of their strangulation risk or even their choking hazard risk because of the small beads. Not only that, but when studied, there's not a lot of evidence to support that they are actually effective. Okay, next one. All right, so we'll talk a little bit about the 6-month stage. So this is when things really get fun. This is when baby's personality really starts to shine through. This is where we start solids, and things get a little bit more hectic, I would say, a little bit more chaotic at home. So let's start with the growth and nutrition. So again, at 6 months, just like every milestone, it's important that we track baby's growth. And just like we talked a little bit about the growth chart, we do want to make sure that your baby is growing consistently across their growth curve. Their primary source of nutrition is still going to be breast milk or formula or a combination. So you can think of solid food as a little bit of an extra, though still very important at this age. So in terms of starting solids in Canada, the general consensus is to start introducing them at around 6 months of age. You can start a little bit earlier too. It's important to start with iron-rich foods, and that's because by about 6 months, babies lose the iron stores that they built up in the uterus. So all babies are born with a good store of iron that they get from mom during pregnancy. But by 6 months of age, that iron store just starts to wear down. And so that's why we always recommend foods that are rich in iron, and it's a great first start. So examples are baby oatmeal cereals that are iron fortified. So you can find that pretty well at any grocery store. You can start introducing chicken or pork, lamb or beef. Eggs are not a bad source of iron. Other sources of iron that are good first foods are chickpeas or lentils, beans, vegetables like spinach, broccoli, and then of course other things like yams, sweet potatoes. So a variety of textures is generally recommended when you're first starting to give your baby solids. So that means a mix of things that are a little bit lumpy. You can of course offer pureed foods, things that are tender cooked, finely minced, of course, to reduce choking hazards, mashed or ground food as well. Soft finger foods are also okay. And then of course, as baby gets older, it's important to offer foods that are less pureed and have a little bit more texture in them. So a big question that comes up often is, what about those allergenic foods? How about things like eggs or peanuts? Those things that we often are afraid to introduce to our babies for fear of an allergic reaction. So it is recommended to start introducing these commonly allergenic foods early, so right at 6 months. Don't delay. Studies have shown that delaying introducing these allergenic foods actually leads to a higher likelihood of the baby developing an allergy. So introducing these things, of course, one at a time, and monitoring your baby while they're taking it. And if they are tolerating it well, then offer it a few times a week. So keep going with those things. So little An easy way to introduce peanuts, for example, is a small amount of peanut butter mixed in with, for example, that oatmeal cereal. And that could be a good way to introduce peanuts. And of course, no honey until they're 1 year of age. All right, next slide, please. Okay, now as far as development is concerned, these are the things that as a healthcare provider, we will ask and make sure that your baby is doing, and that is that they're able to roll from side to side, they're able to sit with some supports around them, they're turning their head to sounds, they're able to reach or grasp for objects. We want to make sure that your baby is able to laugh responsibly and is able to vocalize pleasure and excitement. So they will often do that, and they'll start to recognize familiar faces and vocalize pleasure in seeing those familiar faces. So again, if your baby is not meeting these developmental milestones, it's important to reach out to your healthcare provider. Okay, next slide. All right, so just a few tips on safety here. So of course, at 6 months, babies are a little bit more mobile, they're a little bit more curious, they're exploring their environments. So be aware of choking hazards. Generally speaking, things that are round and smooth, that are small, about less than 4 centimeters, those are big choking hazards. Balloons are another one, pull cords, even certain foods like grapes, which we recommend to quarter or to cut lengthwise. So those are just ways to help minimize choking. And then of course, a falls risk that I've just indicated here. Babies move fast. Even at 6 months, they can roll and move fast before you know it. So change tables, be aware. Don't leave your baby unattended. Be careful with stairs, baby gates. This is the time to get it. And same with high chairs, make sure that they're securely fastened. All right, next slide, please. Okay, so we'll move on to the 12-month milestone here. So we'll start with the growth and nutrition again. So at 12 months, babies are about 3 times their birth weight. So they've really grown a lot. This is the time where they're starting to really eat more family foods with lots of texture and flavor. So really encourage that family meal time with that shared experience. We encourage you to transition from bottle to a cup and do it early. If you can do it right at that 1 year or that 12-month mark, that's even better. Don't do what I did, which is delay until 2, and then you're struggling to try to hide a bottle. So definitely transition from bottle to cup early if you can. Also at this age is where you can transition into giving your baby homo milk, so 3.25% cow's milk. So if they're formula fed, you can transition them to homo milk. If they're breastfed, of course, you can continue to breastfeed, and you can also offer them homo milk at this stage. It's fun to allow them to try to self-feed, give them a spoon, see what they can do with it, or better yet, let them use their fingers and get messy. And then of course, you can also supplement with feeding yourself. Okay, next slide. All right, now as far as fine and gross motor skills, we do again like to see these milestones being met, and that your baby is able to really start moving around. So whether it's crawling or bum shuffling or an army crawl, that they're able to sit without supports, that they're able to pull themselves up to stand, and that they're cruising or even walking by 12 months of age. And that of course they have that pincer grasp, so that thumb to index finger grasp. And of course, that comes along with picking up every single object imaginable on the floor. So those are just some of the things that we do like to watch out for and will ask for when you come in for your routine visits. Okay, next slide. All right, so just talking a little bit about speech here. Oftentimes at around 12 months is when we start seeing, and when we start potentially seeing some red flags in terms of development. And oftentimes that can start with some of the milestones that we just talked about, and also with some speech. So at 12 months, babies should be able to respond to their names. They can understand simple requests. So for example, asking about a body part, where's your belly button, or show me your eyes. In terms of speech, they should be able to make a combination sound using one consonant and one vowel. So that sounds like ba or ma or da. And some babies can say up to 3 words. I would say that might happen closer to 13, 14 months of age. So don't be alarmed if your 1-year-old can't say 3 words. And also don't forget that these 3 words don't have to be clear. They can be unclear words that even you can understand, or that you know that your baby understands. Okay, next slide. And so emotional and social development is also really important here. I've got 2 boxes. The one on the left-hand side is just showing a little bit about what to expect. So at 12 months of age, what's normal? What's normal is that babies will show distress, of course, when they're separated from their loved one, their parents especially. They enjoy being the center of attention. So they've learned that doing some things will garner positive feedback from those around them. They can recognize and enjoy familiar places, for example, grandma's house. They can start to give some kisses or hugs and show some affection. And of course, they are very apt at vocalizing pleasure or displeasure and excitement as well. So the second little box here shows just some ways that you can nurture and support your now toddler's social and emotional development. So the first thing is establishing a really predictable routine. You've probably already done this if your baby is 12 months. Babies, of course, thrive on a predictability, on a routine. So this is the time to really make sure that that's well established. And of course, starting to set some gentle boundaries to make sure that babies start to get used to what may be expectations, and hopefully realistic expectations in the home environment. Offer your baby choices, even if they seem like they're too young and they can't understand. Between 12 and 18 months, engaging with your baby is actually very good for baby's brain development, and of course another way to help to support and nurture their social and emotional development. And I always encourage parents to try labeling emotions right from 12 months. So if you find that your baby appears tired or sad or hurt or upset or happy or excited, use all those words consistently, because as your baby grows, they will start to recognize and be able to identify those emotions as well. Okay, next slide. Okay, and then finally, we'll just talk a little bit about safety here at the 12-month mark. So this is the time to really childproof if you haven't already. So again, make sure that all the electric plugs in the house are covered. Make sure that medication is locked and out of reach, and make sure that you're securing anything that can potentially fall on baby, so dressers and bookshelves, etc. Okay, next slide. All right, so we'll just chat briefly about some early childhood resources here as we are close to wrapping up. So there's a brand new campaign called Feelings First, and it really explores what I was just referring to or talking about, which is the social emotional development piece. I would encourage you to go on the Feelings First website to see what sorts of resources that may be helpful for you and your family. Pathways is also another amazing resource. And it's a great search engine that allows you to see what is local and available to you, again, for your specific needs or your family or child's health, etc., within the Tri-Cities. Another one there is Strong Start, Mother Goose Series, Tri-Cities Children's Services Guide, which I think will ask Carter from the division to maybe link that so that you can access and check out all of these services. And there's also Share Services, which is a local service within the Tri-Cities, and they offer multiple children's services, including the Infant Development Program and other supported child development programs, as well as speech and language therapy, physical therapy, and occupational therapy. And again, we'll have links to that. All right, so I think that wraps up the presentation. Hopefully you haven't gotten too tired of hearing me talk. I think I'm tired of hearing myself talk. All right, so there are some questions that have been asked on the Slido. If you do have any other questions, please go onto the Slido link. It should be in the chat box there, and then use the hashtag babies, and then we'll be able to see them live. So the first question here that's already been asked on the Slido is, what is the best food to start my baby on? So we talked a little bit about that already, but like I had mentioned, generally speaking, foods that are iron fortified or that have a good natural source of iron is recommended as a first food. What I generally recommend is that whatever you're starting with one food at a time to make sure baby is tolerating it. Once you know that your baby's tolerated that food, then you can start to mix with other things that your baby has already tried and has tolerated it well. And then, of course, the iron fortified foods. What's best, of course, is that if you can prepare it. So things, good first foods are carrots, avocados, like we talked about, eggs, minced or pureed beef. And then, of course, those potentially allergenic foods like peanuts are important to introduce early as well. And that leads us to the second question, which is somebody told me that if I give my baby peanut butter early, then they won't get an allergy. Is this true? So it's not a guarantee that they won't get an allergy, but studies have shown that it does significantly reduce the incidence and the likelihood that your baby will develop an allergy to that food. Next question is about sleep. So what's the big deal about baby sleeping in our bed or co-sleeping? The only issue with co-sleeping, and for some families it works well, and that's what they want and that's what they value. The one thing that I would caution parents who do co-sleep is that we know that co-sleeping again can increase the risk of SIDS, and so that's one thing to really keep in mind. That it's easy to get into a really deep sleep. It's easy for blankets or pillows to get into the way. And so of course that's potentially unsafe. And so the safest place for baby is on their backs, in their bed, without anything around them. And that's again to minimize the risk of SIDS. Next question here is, what is the best formula that you recommend? I don't have a specific formula that I recommend. All formulas are pretty well regulated in Canada. They're all more or less equivalent from a nutritional standpoint. Like I had mentioned, some babies do require specialized formulas. So if a baby has certain intolerances or allergies, or certain issues with their digestion or gastrointestinal tract, they may need a special formula. And that would be something that your doctor would recommend based on your specific circumstance or based on your baby's specific health. So most formulas that are available commercially are more or less equivalent. And like I said before, most of them are based on our cow's milk based formulas. Okay, and then the last question that we have right here that's already been asked is, how do I know if my baby is normal? So that's a really good question. I think if you're a first-time parent, you don't have any other children, especially during COVID, where socializing has not happened to the extent that it has in the past, it can be hard to tell whether what you see is normal, what your baby's doing is normal. Is your baby meeting the developmental milestones that they ought to be? And I would say that the way that you would know is by checking in with your provider. And so, of course, we have a way we ask questions, we examine your baby. And so it's important that you check in with your family doctor at those periodic intervals. Usually we recommend, of course, at birth, and then sometimes between 0 and 1 month of age to monitor growth as needed. And then at all of the milestone months, which tends to be 2 months, 4 months, 6 months, and then 12 months. So that's really important. And that's how you know if your baby's developing in a normal way. Okay, so there's a question. Actually, Carter, do you want to read these out?
Yeah, absolutely. I'll start with the first one. I heard that vitamin D will help prevent allergies. Is this true?
That's a really good question. There are a lot of studies that are coming out on the benefits of vitamin D. There are some that have some conflicting evidence. So of course, even in adults, when we talk about vitamin D supplementation, some studies suggest that it actually reduces cancer risk and it improves cardiovascular health. So vitamin D is sort of that new vitamin, or not really that new anymore, but relatively new vitamin supplement that is gaining a lot of popularity because of its numerous health benefits. So when we recommend vitamin D in babies, it's mostly for bone health. So this is why we recommend vitamin supplementation in babies. So it's 400 international units in babies every day. And then in children, it's recommended that they take 600 international units of vitamin D. Of course, vitamin D is also found in certain foods. So vitamin D is found in milk products, for example. So most milk products, especially cow's milk products in Canada, are all fortified with vitamin D. So vitamin D is present in what we consume day to day. Now, about vitamin D specifically preventing allergies, the studies that have come out are not entirely robust. So it's not enough for us to make a solid recommendation, specifically in regards to allergies. However, vitamin D is still recommended. And again, it's mostly recommended for bone health.
Okay, the next question is being asked already, so I'll move on to the next one. But the next one is, my baby is 9 months and not sleeping through the night. Help.
Yeah. So yeah, that's, baby sleep that's a challenge. Lots of reasons why babies don't sleep through the night. And there's, of course, a huge range of normal. So some babies start sleeping through the night, if you're really lucky, early on, 3 to 4 months of age. Some babies don't sleep through the night, even into toddler years. They may still wake up. And they wake up for numerous reasons. We know that babies spend a lot of their sleep time in superficial or light sleep. So they often don't get into deep sleep. If they do, and they sometimes do get into deep sleep, that deep sleep is also, it also fluctuates with that light sleep. And so as soon as baby gets into that light sleep, that's when they often wake up. Now, the key is that how can a baby fall back asleep? And so if you if you get your baby to sleep by nursing or bottle feeding or rocking, and that's the only way that your baby knows how to sleep, then oftentimes when they get up in the middle of the night, 2, 3, or 4 a.m., because they naturally go into that light phase of sleep, they will not have the ability to put themselves back unless you are doing the same thing that you did to get them to sleep in the beginning. So it can be challenging. For some parents, they accept that their baby gets up, and of course, it's important to respond to your baby's hunger cues or cries if your baby does require your attention. But around that 6 to 9 month mark is when you can also start some sleep training techniques. And of course, there's a huge range, and that's a whole talk in and of itself. But there are lots of resources out there on different ways to sleep train. There's lots of even consultants and companies out there that can help with sleep training techniques. I'm a very simple person, and what I usually recommend is encouraging babies to fall asleep on their own from an early age if you're able to. So that means rather than your baby falling asleep entirely on a bottle or on the breast and then placing them in the crib, to make sure that they're just a little bit drowsy so that you're putting them in just a little bit awake, for example. So that can be one strategy to help. Another strategy that can be helpful is making sure that their environment is conducive to sleeping. So some babies need a sound machine, for example. Some babies need a completely blacked out room, so no light whatsoever. Of course, no sounds. Some babies may require no sounds. And like I said, some babies need a sound machine. So you really have to learn how your baby ideally sleeps, and then change the environment accordingly. Make sure that the room is comfortable, not too hot, not too cold. So that ideal environment can also help to ensure that they have a nice, solid sleep. Okay, next question.
Newborns that do not want to sleep in their own bassinets, what's the safest way to have them sleep?
Okay, sorry. Newborns that do not want to sleep in their own bassinets. Okay. So that is the safest way. So I'm not sure what the question, what that person is asking about, how they don't want to sleep on their own. I'm assuming that means that they won't sleep very well in their bassinet. Again, back to the sleep that we were talking about, or some of the sleep strategies that we were just talking about. You can try a different setting. So for example, putting the baby in a crib rather than a bassinet. If that helps at all, you can try a sound machine. You can make sure again that the room is really nice and dark. But generally speaking, the safest place for newborn babies to sleep is on their own, either in a crib or in a bassinet.
Next question is, my baby is 11 months old and not walking yet. Should I be worried?
So generally, no. So walking can happen at 12 months, generally speaking, but it can happen at 13 months, 14 months, 15 months, 16 months. So all of those can be normal ages for a baby to start walking. The key is that baby showing signs of gross motor development? So if they're not walking independently, that's okay. Are they able to bum shuffle? Are they able to sit independently? Are they able to pull themselves up to stand? Do they have really good neck control? Are they able to, for example, bounce if they're in a bouncer? So all of those things tell us that baby is meeting their gross motor milestones, and walking is sort of the last step in that phase. And so if a baby's not walking at 11 months, but they're showing signs of good gross motor development, it's generally not a concern. And some babies may not walk until they're even 18 months of age.
The next question is, my baby is off the growth chart. Is this okay?
Mm-hmm. So that's a good question. It depends on where they are off the growth chart, whether or not they've always been off the growth chart. So some babies are maybe just under the 3rd percentile. And if that baby is getting the a right amount of intake, again, whether it's formula or whether it's breast milk, that they've maintained that growth percentile, then that may be normal for your baby. I would encourage you to check in with your family doctor or with your healthcare provider to make sure that your baby is getting the nutritional intake and recommendations that they need. And if despite everything, they just maintain just underneath that, then your healthcare provider or your doctor might say, okay, well, we'll just continue monitoring. Technically, under the 3rd percentile is considered underweight, and over the 97th percentile is considered slightly overweight. And then anything in between is considered normal. So if your baby is less than the 3rd or greater than the 97th or the 99th, then that really just raises a bit of a flag in terms of having to closely monitor your baby's weight. So I would encourage you to check in and make sure that your baby is still gaining appropriately.
The next question is, I've heard a lot about baby-led weaning. Is this a good idea?
Mm-hmm. So baby-led weaning is the concept that babies will start to move away from the breast when they are ready, or when they initiate that process. So there is often a range. Some people may choose to wean their babies at a certain stage or age. So for example, if somebody is if your mom's going back to work and she can no longer breastfeed, if she has been breastfeeding, then perhaps she will start to wean her baby from the breast and offer an alternative or a milk substitute rather than the breast. Baby-led weaning refers to when babies themselves just stop wanting to be at the breast and prefer other sources, for example, solid foods or other sources of milk. I'm assuming that's what this individual is asking about. And so weaning again can be either baby-led or parent or mom-led. And babies will naturally take less breast milk once they're introduced to more solid foods. So that's generally speaking the process of weaning. The other I think question that may also be being asked in this is weaning in terms of feeding. So babies feeding themselves as opposed to being spoon fed. And so that's another way for babies to, of course, obtain their nutrition or to eat. Personally, there is a range. There is no one recommendation, and I often will encourage both. So I encourage you to feed your baby because there is that interactive piece that helps to establish a good relationship in terms of meal time and family time. And then, of course, we always encourage babies to feed themselves. So with food that is softened, of course, without choking hazards, and for them to actually taste different flavors and textures and to practice that hand-eye coordination and their fine motor skills. So I tried to cover both of those in case that person wasn't sure if they were asking about weaning from the breast or the baby-led weaning in terms of eating solids.
The next question is, when to introduce peanuts and eggs?
Yeah, so we talked a little bit about that, but right at 6 months. So when you are starting to introduce the regular solid foods that you normally would, then this is the time to introduce these potentially allergenic foods, because we know that when we introduce potentially allergenic foods, such as peanuts and eggs, when we do it early and often, it really minimizes the chance that that baby will develop an allergy to those foods later on in life. So right at 6 months.
How often are gluten issues seen when first testing new foods, cereal, etc.?
Yeah. So first of all, true gluten allergy or intolerance, like if we're talking about celiac disease, for example, these are not common. So we don't often see that in babies. If there is a negative reaction to gluten, often what we'll see in children is that they do not grow well. So this is the biggest sign, is that babies will often have a change to their stooling. So usually very loose stooling, sometimes mucus or other changes in their stool, and they will not gain weight appropriately. So this is sort of more of a classic celiac gluten picture, gluten sensitivity type picture that we see in babies, but again, really uncommon and more so identified when babies are a little bit older.
The next question is, what is considered normal for baby snoring?
That's a tricky one. Babies can make noises from their upper airways while they're sleeping. They don't really snore per se. So young children, for example, who have large adenoids and tonsils, they can not breathe very clearly from their nasal passage, and so they tend to be mouth breathers. So that's one sign that we see that can point to obstructive sleep apnea in young babies, or sorry, in young children or toddlers. But snoring is not something that we typically see. Snoring in adults, for example, is related to the tongue being a large muscle coming down into the airways and causing some obstruction and making that noise during breathing while people are sleeping. But in babies, we don't typically see snoring. So I don't know if you're referring to a different type of upper airway noise, but we wouldn't typically see snoring in a baby.
The next question is, what is the best way to help with teething?
Yeah, so that's a really good question. So we talked a little bit about what not to do during the presentation. So for example, not to use amber necklaces, not to use numbing gels. So what can I do? A couple of tips that can be helpful. Rubbing baby's gums with a clean finger or a cool or cold washcloth can be helpful. Offering your baby a chilled rubber teething ring or teething toy. So of course, nothing that's too small, that can be a choking hazard. And it's important to avoid the ones that are filled with fluid because they can actually break under pressure. So a rubber teething ring is generally recommended. And sometimes using pain medication. So if a baby is really struggling, there's nothing wrong with giving that baby some Tylenol or Advil to give them some pain relief. And that's assuming that baby is healthy, and that's helpful if babies are particularly uncomfortable. So again, teething gels are not recommended.
The next question is, I'm currently pregnant and having a hard time finding a family doctor within the Tri-Cities. Do you have any recommendation or tips? What should I do if I cannot find a family doctor before baby arrives?
Good question. So oftentimes whoever is offering you prenatal care will still check baby in the first few weeks of life. The division has a resource for how to find local family doctors, and maybe you guys can link that in at the end of the presentation. And there should be a list of some physicians in the area who are accepting new patients. There are also some physicians that accept mom and babies, for example. So that mom and baby combination will often try to connect with a family physician. So if you guys can just link that, that would be great.
The next question is, when you mentioned the transition to 3.25% milk, is this right from breast/formula? Is it necessary or recommended to go from 1 to 2, etc.?
Okay, so we don't recommend 1 or 2% milk for children who are under the age of 2, and that's because the fat content in whole milk milk is higher, and that is important to meet the nutritional needs of the baby or the toddler. So when I say transition, it's you can transition. So babies can be breastfed up until whenever you want to continue breastfeeding, and you may not need to give whole milk to your baby. Some babies who are given formula around the 12-month mark is when you can transition from formula to regular cow's milk, which is whole milk, not 1 or 2%, but just the whole milk. In terms of transitioning, it doesn't have to be an overnight transition. I'll often tell my patients at least if they can do a mix, so that you can mix, for example, a quarter of whole milk with 3/4 of formula, and do that for a few days to get your baby accustomed to the flavor, and then eventually 50-50, and then you can do 3/4 whole milk with a quarter formula, and then eventually just transition straight to whole milk. But we don't recommend 1% or 2% in babies under the age of 2.
Okay. Thanks for all the questions, everyone. I just wanted to say thank you to Dr. Sorial for the wonderful presentation, and a thanks to everyone for attending the first session tonight. What I'll be doing next is I'll send an email out to everyone who provided their email address with a quick survey link, an overview of some of the resources that we chatted about tonight, and the division resource on how to connect to a family physician. We'd really appreciate it if you took a few moments of your time to complete the survey. It just allows us to understand what was successful and what could be worked on for the future. If there's any other questions tonight, I will put my email address in the chat box, and you can go ahead and send me an email, and I can connect you to the right resource and get questions answered for you. So with that, I just want to say have a great night, everyone, and good luck with future parenthood. Thank you.
Thanks for joining us.